My name is Joe Sisson. I'm from Waterloo, Iowa, so I'm a Midwesterner. And I went to undergraduate in chemistry and biology at the University of Northern Iowa in Cedar Falls. I then moved to Iowa City, where I went to medical school, and moved for my residency to Salt Lake City at the University of Utah, where I did internal medicine. I then went on to do my fellowship in pulmonary and critical care medicine with an emphasis on research. And after 3 more years of training, I went to the National Institutes of Health, where I did a research fellowship. I've always been interested in critically ill patients. It seemed to challenge me and all of us. And I found that the sicker someone was, the more calm I was, and it seemed to be the right match for my personality. I've also been interested in lung disease, and specifically the way the lung works and how we protect our lungs from infection, and that's sort of where my research interests lie. The area in general that I'm interested in are airways diseases. So these are problems of the trachea and the bronchial tubes. So things that come to mind would be asthma, COPD, bronchitis, those kind of things. And pneumonia, of course, is related to that. And so those are common problems. We see them all the time. In the intensive care unit, we also take care of a lot of critically ill patients who have complications of other problems, such as cancer, chemotherapy, radiation therapy. As a cancer center, we have a lot of those people. We also take care of patients that are on their way to getting a transplant. One of the great things about working in an academic medical center is you're never bored. And so I do research part of the time, which is a very different, very focused experience. I take care of patients, which is always immediately gratifying, but it's sort of all over the map, from people who are well getting checkups to critically ill people in the ICU. And then I also enjoy teaching, and because I will do all of those things in the course of a few days, there's never a dull moment. I think physicians are in a special place where they're given by society the resources to learn how to become an expert in healthcare. And our sacred trust is to remember where we came from and who we are. We are people just like our patients. And so we have to have that in common to be able to act as their advocate and advise them and help them with their healthcare problems.